everyone, I am Monica de Guzman, a student nurse from Davao Doctors College. And so for today's video, I will be demonstrating on how to properly examine the thorax and the lungs of a patient. So, before anything else, let me show you the materials needed for this assessment. I just want to introduce myself. I am Monica de Guzman, a student nurse from Davao Doctors College. And before I start examining the patient, I want to ask your consent if you are going to allow me to touch a certain parts of the patient's body, because I'm going to inspect, percuss, palpate, and auscultate him. Would that be okay with you?
Yes.
Okay, so in this assessment, ma'am, I'm going to assess his thorax and as well as his lungs. And to be able to do it, I might gonna ask him to lay into a supine position, and I might gonna ask some question regarding to his health history. Would that be okay with you?
Yes.
Okay, so do you have any questions regarding to this assessment?
None.
Alright, thank you so much, ma'am. Okay, I already done performing my hand washing to avoid getting any pathogenic microorganism and to avoid cross-contamination with my patient. So I already closed the windows and the doors to give my patient a privacy to make him more comfortable throughout our assessment. And my patient has no medical record, previous medical record, because it's his first time for a checkup. Hi sir, I am Monica de Guzman, a student nurse from Davao Doctors College, and for verification, may I ask what is your name?
Marco M. Asilas.
Alright, Mr. Marco. So, when is your birthday?
May 10, 2010.
Okay, how about your age?
11.
Alright, before anything else sir, may I ask what do you want me to call you?
JM.
Alright, JM. Okay, JM, before we start, what language do you want me to speak with you?
Bisaya and English.
Alright, thank you. So, I'll just explain the procedure to you today. I'm going to assess your thorax and as well as your lungs. And for me to be able to do it, I'm gonna palpate. I'm gonna doing a inspection, percussion, and auscultation, of course, palpating. And I'm also listening to the sound of your breath. And rest assured that everything that I have documented will remain confidential between me and the attending physician that I will be referring to you. Would that be okay?
Yes.
Okay, okay, JM. So, right now I'm going to collect your subjective data. I'm going to ask some questions regarding to your health history. Would that be okay?
Yes.
Alright. GM, do you experience difficulty of breathing?
Sometimes.
Alright, how about chest pain?
Sometimes.
Alright, so do you experience coughing right now?
None.
Alright, so for your past history, have you have any thoracic surgery?
None.
Alright, respiratory problems before?
None.
Alright, how about allergies? Do you have any?
None.
Okay. So how about had influenza immunization, X-ray, or biopsy?
No.
All right. For your family history, does your family had a background of respiratory problem
No.
or lung disease?
No.
All right. Good for you. So, for your current lifestyle, do you smoke?
No.
Okay, so your environment, have you been exposed to a second-hand smoking?
Sometimes.
Okay. Do you have any difficulty in doing your daily activities?
No.
Okay, that's great, sir. So again, I'm going to assess your thorax and the lungs, and for me to be able to do it, I'm going to inspect, palpate, and percuss. And of course, auscultating you and to listen the sound of your breath. Would that be okay, sir? Okay.
Yes.
Thank you so much, sir. Okay, right now I'm gonna note the diameter of my client's chest. So I'm gonna ask you, sir, if you can breathe normally for me. I'm just gonna check your breathing pattern, and of course I'm gonna check if there's any bony deformities or abnormalities. Okay. Right now I'm just gonna palpate your suprasternal notch. Alright, right now I'm going to examine the posterior thorax and lungs of my patient. So can you cross your arms for me, sir, and put it in the opposite shoulders? Like, right, that's great. So can you tell me, sir, if there's any area of pain? Can you deep inhale and exhale deeply for me, sir? Alright, that's great. Just gonna palpate it, sir. Right, sir. Can you inhale, sir, and hold it in, sir, for me? Alright, that's great, sir. Alright, that's great. Just gonna auscultate you, sir. Can you say the word 99, sir?
99. 99. 99. 99. 99.
Letter, can you repeat the word letter E?
E. 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 E.
Okay, can you repeat the word, can you whisper 1, 2, 3, sir?
1, 2, 3.
Alright. Okay, I already done performing the posterior thorax and lungs of my patient, and right now I'm going to perform the anterior thorax and lungs of my patient. So for me, for enable for me to perform it, I'm going to ask my patient to lay into a supine position to see if there's any abnormalities in his breathing position and other problems about his lungs and thorax. So let's get started. Okay, I already positioned the patient into a supine position to observe if there's any chest deformities, and of course to observe his pattern of breathing and a condition of the skin. So can you breathe normally, sir? For me to be able to observe. Alright, that's great, sir. I'm just gonna palpate it, sir. Okay. Can you breathe deeply for me, sir? Alright, that's great. So, just gonna palpate it, sir. Alright. Can you say the word 99, sir?
99, 99, 99, 99, 99.
Can you say 99, sir?
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Alright. That's great, sir. Right now, I'm going to state the findings of my client's checkup with his guardian. So, in summary, upon inspecting your thorax, spine is well aligned, vertically aligned. Spinal column is straight, right and left shoulder, and as well as your hips are in the same height. So you don't have to worry about that. There are no abnormalities in inspecting your fingernails. The color is pink, and as well as your face and your lips. So for the temperature and integrity of this skin is intact, uniform temperature, and chest wall, no tenderness and no masses. So which is normal. So and auscultating in your posterior thorax and lungs, I heard some crackles, which is abnormal. So you have to minimize doing hard activities that may trigger your chest pain. Okay. So in inspecting your anterior thorax and lungs, so I observed that you have a 16 breath per minute in full minute. So you have a quick and shallow breath, which is normal. So for palpate the vocal frematus is I felt like exhaustion most clearly at the apex of the lungs. So that would be all. So I just want to advise you to minimize all the hard work, hard activities every day. So that your chest pain will never be triggered, and of course your difficulty of breathing. So do not carry heavy things, and you should exercise as long as you can. And of course, drink plenty of water if you can, and of course eat some vegetables and healthy foods and healthy diet. That's all. Thank you so much, ma'am, for your cooperation, and thank you so much, sir, for your cooperation in this assessment.